Welcome to the fitness world of physical education. Today, in this lesson, you will learn about exercise physiology and the role it plays in fitness. You will also learn about the areas of specialization and goals of exercise physiology. First is, what is exercise physiology? When you exercise, you are helping build a strong and healthy body that will be able to move around and do all the things you need it to do. Exercise physiology is simple and understanding of how every body responds to exercise. It falls under the umbrella of kinesiology, which is the scientific study of human movement. Exercise physiology examines how your body's cell and organs such as your cardiovascular, muscular and respiratory systems are changed when exposed to acute, short and chronic long over time bouts of exercise. Exercise physiology is the identification of physiological mechanism underlying physical activity, the comprehensive delivery of treatment services concerned with the analysis, improvement and maintenance of health and fitness, rehabilitation of heart disease and other chronic diseases and or disabilities, and the professional guidance and counsel of athletes and others interested in athletics, sports training and human adaptability to acute and chronic exercise. Exercise physiologists use exercise to model or define physiological concepts, that is, hows and whys of the function of human body or how the body works. An example of this is the study of the heart as being analogous to the study of an automobile. A car enthusiast can look at a parked and non-moving automobile and marvel at its design. A physiologist wants to know how this design works. Under the description, an automobile must be driven to determine its true qualities. Likewise, exercise must be undertaken to determine not only how the heart works, but skeletal muscle as well. Moreover, a person's response to exercise can be used to determine the potential extent of certain diseases as well as being used to rehabilitate certain disease states. Exercise and health are inextricably linked. First is exercise. It is the performance of movement in order to develop or maintain physical fitness and overall health. It is often directed toward also the honing of athletic ability or skill. Frequent and regular physical exercise is an important component in the prevention of some of the disease of affluence such as cancer, heart disease, cardiovascular disease, type 2 diabetes and back pain. Types are depending on the overall effect of the body. There are 3 types. First is flexibility, second is aerobic and anaerobic. Types of exercise. Flexibility. These are exercises performed to improve the range of motion of muscles and joint. Aerobic. Rhythmic in nature, use large muscle groups and can be maintained continuously. Here, the working muscle draw and oxygen in the blood as well as fat and glucose to increase cardiovascular endurance that causes the heart to work harder than at rest, and muscle density. Anaerobic. Anaerobic involves intense or explosive sports or strenuous activity that leaves one gasping for breath. It can be done for a minute or two at a time because it depends on limited supply of glycogen that is rapidly depleted, resulting in intense muscle fatigue. Benefits of physical exercise: maintaining physical fitness including healthy weight, building and maintaining healthy bones, muscles and joints, promoting psychological well-being, reducing surgical risk, strengthening the immune system. Next is physiology. Coined from these two words, physis meaning nature or origin, logos meaning speech or talking about something. Physiology is the study of mechanical, physical and biochemical functions of the body as a whole and of the structures found therein. Exercise physiology. It is what happens to the body as it exercises a single time, how these changes are brought about, what changes in function occur after repeated bouts of exercise, and how these changes come to pass, and finally what can be done to improve the body's response to exercise and its adaptation to training. It is the description and explanation of functional changes brought on by single, acute or repeated bouts of exercise, chronic exercise or training, often with the objective of improving the exercise response. Next is, it is the identification of physiological mechanism underlying physical activity, the comprehensive delivery of treatment services, concerned with the analysis, improvement and maintenance of health and fitness, rehabilitation of heart disease and other chronic diseases and or disabilities, and the professional guidance and console of athletes and others interested in athletics, sports training and human adaptability to acute and chronic exercise. Next is scope. It deals with such areas: cardiorespiratory responses to exercise, muscle fiber types, metabolism and body composition assessment. Scope of practice. Exercise physiologist. Exercise physiologists are 4-year university qualified allied health professionals who specialize in the delivery of exercise, lifestyle and behavior modification programs for the prevention and management of chronic diseases and injuries. Exercise physiologists provide physical activity and behavior change support for clients with conditions such as cardiovascular disease, diabetes, osteoporosis, depression, cancer, arthritis and many more. Physical fitness. It is the ability to function effectively and efficiently. It is associated with a person's ability to work efficiently, ensure leisure time, be healthy, resist hypokinetic diseases and meet emergency situations. It is used in two close meanings: general fitness, a state of health and well-being, and specific fitness, a task-oriented definition based on the ability to perform specific aspects of sports or occupations. Physical fitness components, health related. First is body composition, second is cardiovascular endurance, third is muscular endurance, fourth is flexibility and fifth is strength. Skills related. First is agility, second is balance, third is coordination, fourth is power, fifth is reaction time, sixth is speed. Responses and adaptations. Exercise result in responses and adaptations depending on time, type, intensity and frequency. Training. It is the systematic process with the objective of improving an athlete's fitness in a selected activity. It is a long-term process that is progressive and recognizes the individual athlete needs and capabilities. Training program use exercise or practice to develop the qualities required for an event. Responses. These are the sudden temporary changes in the function caused by exercise. These functional changes disappear shortly after the exercise period is over. Examples are increase in heart rate, rise in blood pressure, increase in breathing. Adaptations. These are the persistent changes in structure or function following training that apparently enables the body to withstand repeated bouts of exercise. Examples are reduction of the heart rate for submaximal exercise load. This allows the heart to pump the same amount of blood to the working muscles at a lower energy cost for the heart. Increased muscle size after strenuous weightlifting program. The lifter exerts greater muscular force than before training. Why study exercise physiology in physical education? To answer the question on why and how of things, to select activities, to get information about sex difference, age difference, the effect of exercise on male and female, to explain type of exercise for different sexes, age groups, etc. All are observed for the enhancement of health, physical fitness of the general population, improvement of athletic performance. Exercise physiology goals. There are two distinct goals of exercise physiology. The use of exercise to further understand how the body functions. The use of that knowledge to develop activities and programs that establish, maintain and promote physical fitness. Knowing how your body responds to short-term bouts of physical activity and how it adapts to repeated bouts of physical activity over time can have a profound impact on your health and help you reach a higher level of fitness or health long term. For example, cardio or aerobic exercise can affect your mood immediately after a brisk 30-minute walk. Your body releases endorphins, natural pain reducing substances that can give a sense of well-being. Knowing that walking has a positive effect on your mood tells you that incorporating walking into your fitness program long term may help with health issues and can reduce stress, depression, anxiety and tension. Areas of exercise physiology. Exercise physiology can be split into two main areas of specialization. First is fitness, second is rehabilitation. Fitness can help the professional athletes improve their performance or help people to lose weight and become more healthy and physically fit. The rehabilitation focus seeks to provide health benefits to those suffering from disease such as diabetes and cardiovascular disease. It can also help people who are recovering from injuries or dealing with chronic conditions such as arthritis and lower back pain. What is the meaning of exercise physiology? Exercise physiology is the study of how the body reacts to physical exercise in both the long and short term and how the body adapts to ongoing exercise and any changes to a routine. It is a growing area of study in both the medical and fitness field. The growth of this discipline has given way to a large number of career paths dedicated to studying the effects of exercise on the human body. But what is the meaning? Does studying the relationship between exercise and the body reaction to it have any tangible benefits? Exercise physiology has many tangible benefits that doctors and fitness experts agree on. But like any area of study, it also has its fair share of quacks that use the research as a means to promote untested exercise routines, equipment and dietary supplements. If you are considering the advice of an exercise physiologist in beginning a new exercise regimen, use a little bit of common sense in determining the validity. Exercise physiology must definitely plays a role in other fields including hematology, biochemistry, pathology and cardiopulmonary studies. In fact, it's not uncommon for exercise physiologists to also be engaged in one of these other disciplines. Exercise physiologists can be not only scientists in another field, but also clinical researcher, athletic researcher, trainer and fitness expert. The combination of all these other disciplines serves to enhance exercise physiology most of the time. Relying only on the knowledge of the short-term effects of cardio doesn't really address the question due to the fact that weight loss is almost always a long-term thing. Exercise physiology is an established discipline. Those involved in the field of study would do themselves and their colleagues a great service by working together to establish concrete guidelines for study and research. Researchers in other fields will also benefit by working with exercise physiologists to understand how the body reacts and adapt to physical exercise. The benefits of exercise physiology. The benefit of incorporating exercise session into one treatment plan include more restful sleep, increased energy, improved muscle strength and endurance, improved circulation, improved mood, improved self-image, self-esteem, lowered anxiety and depression. Additionally, regular workouts can improve a person's ability to fight off relapse for the long term in recovery, providing one of the few therapeutic resources presented in a rehabilitation program that can easily be implemented in any context, even after the recovering person leaves the treatment. Physical detox. When experiencing withdrawal symptoms, the last thing that most patients want to do is exercise. Most people want to avoid doing anything that could potentially cause any more discomfort. A strong body through exercise will fare much better when facing physical withdrawal symptoms caused by detox, says Corbett. Even gentle exercise, walking, swimming, light weight, etc. can provide some relief from withdrawal symptoms and even help patients to get through detox more swiftly. Emotional balance. Extreme up and down often characterize the experience of those in early recovery. Those in recovery may feel exuberant to be feeling better and more clear-headed as the withdrawal symptom pass, but scared of what the future may hold and sad over the losses of long-term addiction. These feelings can also meld together and be difficult to manage. Exercise is a great defense against the mood swings that come with early sobriety. According to Corbett, exercise increases endorphins or good feelings and improves the person's sense of well-being, while also improving self-esteem and self-confidence, which in turn can help person to make better choices in all aspects of life. Stobbe says regular physical activity can provide a healthy outlet for stress, depression and other emotions they may face during early sobriety. Exercise allows our clients to release endorphins, heal and strengthen their bodies, and improve their body image and self-esteem. Next is positive new habits. Removing use of drugs and alcohol can leave significant holes in a recovering person's schedule, holes that aren't easily or comfortably filled. Stobbe says in early sobriety, exercise provides a new activity that is healthy and can be a positive way to fill the time previously spent using substances. Corbett agrees, saying that exercise sessions encourage patients to create goals and challenge themselves. When we have goals, we tend to focus on those and not the outside distractions. Personalized therapy sessions, like every part of addiction treatment, exercise physiology sessions should be personalized to meet the needs of the individual. No two people are alike in their experience of addiction, and thus their experience in recovery should be unique as well, and that especially applies to their exercise sessions. Stobbe says a client's exercise physiologist should always be able to modify their workout for any injuries and should be able to adapt all program to meet their specific needs. They should be able to update their exercise prescriptions for each client as necessary. Their exercise physiologist should be able to perform body composition if needed, increasing the effects of exercise sessions. Patients can get the most out of their exercise sessions by implementing other positive practices and behaviors in their lives, not just during the exercise session, but throughout the week as well. Corbett says that attitude change everything. I have experienced the patients coming into the fitness center with no motivation or desire to work out at all. They don't care and are dragging. But after we talk and convince them to get started the change in their mood and how they live, they are like two different people. This has such an effect to witness them going from gloom walking in to leaving feeling good about themselves and wanting more. It literally seems people change after a session. Stobbe also says that taking part in other holistic treatment options like meditation, massage therapy and outdoor sports and activities will benefit the patient's ability to make progress in exercise session. Additionally, patients are encouraged to get the most out of their exercise sessions by eating healthful throughout the week, maintaining a regular sleep schedule, attending all exercise sessions, showing up with a good attitude and ready to train, avoiding putting pressure on themselves, setting small goals, celebrating the progress they make. So, this is all about meaning, scope, physiology of exercise and its importance in our life. So, friends, the importance of fitness is very much important in this technological age, and every person needs fitness at every age group. Thank you. Have a nice day.